This class represents the wave of the future in nursing. These Seton Hall graduate students are being educated as clinical nurse leaders. CNLs are nurses who do bedside care and also have leadership and management training to help their healthcare facilities work more efficiently.
The clinical nurse leader is an innovation in the delivery of healthcare. The clinical nurse leader follows the patient from admission through discharge and focuses especially on complex healthcare problems that improve patient care outcomes. This is the first program like it in the state of New Jersey. We welcome applications from students regardless of their major at the baccalaureate level. You do not need to have a nursing background to enter this master's program.
These future CNLs are all college graduates, but have very different backgrounds. Ron Rita had never even heard of a CNL when he was a fisherman in Alaska. When he moved back to New Jersey, he decided to pick a career with a good future, one that would also give him a chance to help people. Inessa Semenov grew up in Russia and immigrated to America, where she earned her college degree online. She was working as a medical secretary in Brooklyn and realized she would rather take care of patients than work in an office. Nneka Jefferson is from Nigeria. She's also a mother of two who earned an MBA and spent 20 years in corporate America.
I really like taking care of people. I like making people feel better and adding value to their lives. And that's why I want to be a nurse.
Nneka studies alongside Rebecca Stanley, who earned her undergraduate degree in fine arts. After her sister was diagnosed with cancer, Rebecca was her bone marrow donor. Helping her sister through her illness inspired Rebecca to become a nurse.
It's a very intense, time-consuming program, well worth it, and you get to experience all aspects of nursing all at the same time. You have classroom time, you have lab time where you learn the skills that you need to be a nurse, and then you also experience the hospital setting in your clinicals every week.
Classes are small and taught by CNLs and other expert nurses.
They come to us sharing the textbook, but also their practical experience.
We get to review procedures, treatments, and diseases that you would experience as a nurse.
Other classes like this one called Theory and Evidence-Based Practice teach management and research skills that will help CNLs improve patient care. The instructor is an associate professor who is also a CNL with a PhD in nursing theory development and research. In the class, she teaches students how to identify problems in their clinical settings, find the most current scientific research and the most efficient nursing practices, and how to implement those changes where they work.
The labs gave me a lot of confidence and a lot of practice time. It gave me the skills that I need to go into the clinicals.
Students are in different clinical rotations throughout the program. Here, Rebecca and her classmates assist nurses on an acute care floor of a large hospital.
When I'm at the hospital, I get to administer medication with my professor. We get to experience dressing changes, wound care, basically any experience that a nurse would go through during the shift that we're there, we get to do.
I get a lot of varied experience in this program. Last semester, I went to an adult facility, and this semester, I'm in a hospital. I feel like these different experiences will make me more marketable in the workforce.
It's fun to go through this program with people that have various different backgrounds, and all of their experiences are a huge asset to your education.
I think studying with people with such diverse backgrounds will make us all phenomenal nurses. America is a multicultural place, and in our class we're getting the experience of working with different people.
We are so proud to offer the CNL program at Seton Hall University. These nurses are destined to make a difference not only in patient care outcomes, but also in cost containment.
I'm really excited to finish school with a CNL certification. It's going to give me the experience I need to be on the cutting edge of healthcare, and I'm really glad that I decided to do this program.